everybody. This is Tim Rowan. Welcome to this episode of Meet the CEO. I'm very happy to be introducing you today to Rich Berner, who is a newly arrived CEO at Complia Health. Rich, welcome to Meet the CEO.
Tim, good to be here. Really appreciate you carving out some time to get together with me before the holidays. Early Thanksgiving to you, and I guess by the time your audience watches this, it will probably be a post-happy Thanksgiving to them, and I hope it was a good one, and I hope they're full and ready to hit their exercise routine before the holiday seasons continue.
Yeah, some people might not be watching this until it's time for New Year's resolution, so we'll have to wait and see what kind of feedback we get. So, exactly. Rich, I introduced you as new to Complia Health. How long have you been there?
It's been just over a year and a half now.
And you have not been in home health, home care before. So can you start by getting us familiar with your history? I'm curious to see where you've been, what experience brought you here.
Absolutely. I come at this as a technologist. I grew up geek, programming computers, graduated in computer science a long time ago. And spent the first decade of my career outside of healthcare in mostly business to consumer businesses, which is helpful now as we start to focus more on the consumer experience in healthcare, albeit a couple of decades late. But I have had a journey throughout touching, not a planned journey, but have touched many aspects of healthcare through some time at Cerner Corporation, and then helped stand up the Microsoft GE joint venture, Caradigm, and was running about half of Allscripts before joining MDLive as CEO. And then a year and a half ago came to Complia Health. And while not a clinician, I did have a mom who became a nurse at 40 years old with 5 kids. So I saw firsthand why healthcare is more of a vocation than a job for many people. And when I got in healthcare, I drank the Kool-Aid right away, and it's been a life's mission and journey for me now.
So some of those companies that you mentioned, Cerner and Allscripts and MDLive, deal with healthcare in the broadest of senses, mostly hospitals and physician clinics. What brought you to our little corner of the world in post-acute care?
It's interesting that you say little corner. I know somewhat half joking, half serious, but I think it's going to be the next big corner. I mean, I got into healthcare originally coming out of those business to consumer businesses saying I wanted to make it better for consumers. And, spent the first decade of my healthcare career really focused on trying to make a better experience for care teams, doctors, nurses, health systems. And joined MDLive because I saw telehealth as the first real opportunity to, frankly, do what's happened in every other industry. Move it online, automate as much of it as possible, and put healthcare on consumers' terms. And had a lot of great experience there, doing things like moving the net promoter score there from a score of 54 to a high of 84, which is higher than companies like Google and Apple and Netflix. And I got into or joined Complia Health, not only because I wanted to run a post-acute EMR company, but I saw it as the next phase of disruption in healthcare, where a lot of the progress we made at MDLive in primary care and behavioral health and urgent care and moving that online, that was going to be needed, and demand was going to grow for that, for services in the home. And frankly, if I think back to 2008, 2009, when the HITECH Act came out and meaningful use, I feel like if we would have started a lot of those initiatives in the home instead of in the hospital or the doctor's office, we'd probably be a lot further along, in fixing our healthcare system and bending the cost curve. So I absolutely believe that the pace of change, outside the hospital is going to grow dramatically in the next decade, and the focus of the government and the payers is going to match the growth in demand from the consumers to get care on their terms, and that's ultimately what attracted me to the post-acute setting at Complia.
I'm really curious and focusing on your initial comment about home care home health, hospice, in all care in the home being the next big thing. Um, One of the things that we do here on Meet the CEO is try to look a little bit into the future. So, in the year and a half that you have been with us in this little corner of the healthcare world, what do you see? What has impressed you most? Not only just how we differ from healthcare in general, from physician services and surgery and medications and the like, but where do you see it going with regard to the aging population, the state of reimbursement for Medicare and Medicaid, and the rise of private duty, personal care? Can you give me a kind of an overall? Because I know in ContinuLink you deal with all of those. So, um, what have you learned so far, and where do you see us going?
Well, I think there's if I pointed to three big trends, I'd say, first of all, there is recognition that reimbursement is going to continue to put the squeeze on agencies for better or for worse. And this, I think, is people are coming to the recognition if we stay single service line focused and stay fee for service focused, that you're eventually going to get commoditized and likely be out of business, or it's going to be much tougher to stay in business. So this is forcing people to think about diversifying their service lines, whether that's organically or through acquisitions. And this M&A that is going on is the good news about it is it's accelerating change, and it's forcing people to think more broadly about how do I care about the person as a whole versus a patient and a condition. So the first big trend is M&A is going to cause service line diversification. And the second big trend is that with that service line diversification, there's going to be a greater shift towards meeting where the government and the payers are trying to go with risk-based contracts, and able to do that profitably, delivering the experience consumers want with high quality and lower cost. You're going to have to think about how do I manage patients proactively and predictively versus reactively. And then the last trend that I see is the focus of, COVID helped the industry realize, hey, there's things we can do remotely. There's things we can do in an automated fashion. And some of those trends are going to stick and grow as the industry and agencies start to realize, while yes, consumers want to see their caregiver and oftentimes want to see them in person, many times, like every other industry, they want convenience over some of that face-to-face interaction. So I think a move towards remote care. And then underlying all this is obviously the staffing challenges. Every single agency, whether home health, home care, or hospice, is struggling with staff. That's forcing people to think about, how do we drive more productivity? How do we automate the simple and routine so that we can increase staff satisfaction and retention? And that ultimately leads to, how do we manage more things remotely on a more regional or national level so we can drive more efficiencies as well.
You talked about quite a number of pieces there, but I want to focus on one of the things you said about remote care. That you're right about. That's one of the things that we learned during COVID, is that it is possible to take care of people without having to drive to their house every day, or at least look in on them and know how they're doing from day to day. Have you taken a look at the various technologies that are available? They range from devices in the home to tablet and phone-based systems. Is that something that you see ContinuLink taking an interest in?
It absolutely is. I mean, our philosophy at Complia Health starts with, if we create the best product in the industry, the rest of our strategy becomes much easier, because it's easier to attract great talent. You have happier clients with a great product, and those happy clients buy more and tell others to do the same. And so to have the best product in the industry, we have to think like every other industry and what's going on with it. We have to approach healthcare the same way Amazon approached books, then DVDs and music, and then every other thing they do, which is how do we predict consumers' needs and prevent bad things from happening before they happen. And how do you do that? Just as an example, a wireless scale for a congestive heart failure patient. If I'm stepping on that scale every day, speaking to where we opened up with the weight that we'll probably all put on over the next couple of days, weeks here through the holidays, and we focus on our health. If I can step on that scale every day and it automatically gets uploaded, and if there's a trend where with a congestive heart failure patient, if your weight jumps significantly in a few days, that's usually an indicator something is going wrong. And if I can automatically, based on proactively monitoring that weight, reach out with a chatbot that says, Rich, looks like your weight has gone up in the past 5 pounds in the past 3 days. What have you eaten? What have you done? And that automated interaction, which is simple and on your phone, then the intelligent monitoring of it says we probably need to get you connected with your care coordinator or your home health aide, or maybe it's a therapist or a physician. And if it's a physician, then maybe you need to adjust the dose of your Plavix, and you get that shipped to your home automatically that day or the next day, and that prevents something from spiraling down or getting out of control. So our philosophy is we help drive staff retention by automating as much of the simple and routine as possible for them to make their job easier. We improve the consumer experience by delivering care where, when, and how they want to deliver. Well, how they want it delivered. In person when it needs to be in person, remote when it needs to be remote, and in a timely fashion that works within their schedule. And then the other thing we think about is, I'm have to admit that I'm a Gen Xer now, and I used to think I was younger and leading technology, but now as a Gen Xer, we're getting up there, and my parents are becoming, consumers of the agency services. And so we have to think a lot more, not just about the consumer or your patient, or your client, whatever term you might need, but their family members, because the experience is so tied to their family experience. So if you think about if my father needed some home health care, if I could get on the call with them when my mom does and my sister can, versus also all barraging my mom with questions she asked or didn't ask, and she's stressed because she's just trying to care about my father. How much better is her experience, my dad's experience, and the family's experience going to be when we're all connected and sharing information, when of course all the permissions are there. The Gen Xers are just going to expect a completely different level of experience than has been provided in the last decade, because we grew up with technology. And I think that's only going to grow as the population ages and the kids who are taking care of the parents are aging as well.
You also talked about the M&A movement, and we have been watching this for 3 or 4 or more years now, where the smaller agencies that are perhaps having a little more difficult time surviving are being gobbled up by some of the large ones. I heard, how people like to exaggerate. I heard somebody predict a couple of years ago, one day there'll be 4 home care agencies in the country. But what has been happening is that the larger ones are getting larger. The middle is kind of staying where it's at, and there are fewer and fewer smaller ones. This has good and bad implications. Larger organizations are better equipped to withstand the changes of reimbursement and staffing shortages. But then again, the small agencies usually serve remote areas where there is no other alternative. And if they disappear, now sometimes when they're absorbed, they don't disappear. They just change their name and they stay working in the small rural community. But that's a concern and a danger with the M&A movement as well, isn't it?
It absolutely is. I think, but smaller agencies and mid-sized agencies, there is going to be a role for them to play but they do have to change the way they're thinking. I think if you're not going to diversify service lines and try and grow, you have to think about where is the future of healthcare outside the hospital and the doctor's office going, and then figure out what role you want your agency to play. And then technology can no longer be an afterthought that I want to roll out an electronic medical record so I can automate my billing and make sure I get paid on time and make sure I'm compliant. It has to be more about how can I can only grow so much, particularly in these more rural areas. And again, everybody's having those staffing challenges. So how do I leverage technology to increase the satisfaction of the team that I have and increase the productivity of the team I have so that I can scale faster than hiring? Because no one's going to be able to hire at the pace that they need to keep up with these larger agencies. But if you leverage technology, you understand what the broader strategy is in your region, and then decide where you want to fit in, whether you want to be one of the large ones growing market share in a region or even nationally, or if you want to be, you're really good at hospice, that's your mission, that's your passion, that's what you want to do, then you need to figure out who you're going to partner with, and partner in a way that is easy to partner, so it's a seamless consumer experience, so that the whether it's a hospital or health system or a larger agency, you are bringing value to them beyond just the service line that you have today. You're helping them grow or increase their member, their client, their patient satisfaction.
You also brought up the topic of taking on risk as coming out of the hospital and physician EMR world as you have. You might be better equipped to discuss that than others. Home care, home health are both having to deal often with managed care and Medicare Advantage, and that often involves contractual relationships that set a set fee, which, as everyone has been telling me, is usually lower than what you can survive on. So the negotiating of the contract goes a long way toward ensuring profitability for a home care provider. So do you see any movement in the direction of home care taking on risk with payers, risk with managed care, in order to take more responsibility and potentially reap a higher monetary reward?
Well, here's what I would suggest. Whether or not an agency actually decides to take on a material amount of risk themselves, the more an agency understands how to do that and is prepared to do that, and can partner with MA plans or MCOs or even direct, they're going to increase their chance of success in the future. I think everybody in healthcare knows the government has been trying to move away from fee for service towards value-based purchasing, at risk-based contracts since 2009, 2010. And while it's taken much longer than anyone's wanted, I think everybody recognizes it's starting to pick up steam. So again, as an agency, the more you can shift your thinking to, hey, I'm great at providing this service when it's needed, to how do I understand the consumer that I'm working with and predict and prevent things from happening that didn't need to happen, and how do I prevent waste, the better prepared you are that if you are in a risk-based contract or just partnering with somebody that takes on risk, the better prepared you'll be to actually lower the cost of healthcare overall for the country, yet increase your profitability and the consumer experience at the same time. It has happened in every other industry, and it's going to happen in healthcare. And so while it's scary that it's coming, and it's likely still going to take longer than we think, it's going to be good for everybody involved as we move forward there. as long as you are thinking innovatively, diversifying, and thinking about the role you want to play. If you are hanging on to the past and trying to stay being the best at the way things used to operate, it's going to be a tough decade for you.
Yes. In other words, if you want to be a significant player with a major role going forward, that type of change is mandatory.
Yeah, and even again, if you decide, okay, I don't want to run everything outside of here, but I want to, as you said, you might have a personal care services company that's in a rural area. That need is always, even as we move stuff remote, we're still going to have, in the personal care services space, there's going to be needs for in-person care. But even if you decide that I'm just going to stay focused on that and partner with somebody, to partner with that person or that agency that's taking on risk, they want you to understand how to get the most out of the dollar spent with that consumer as part of, because they're taking on risk. So they're going to expect you to understand and be a good partner, both from a clinical outcomes and consumer experience, but fiscally as well.
It's long been the case that payers of all types, public and private, have decided somehow that cutting back on paying for in-home care is going to save them money. And every study that I've ever seen shows that it does not save them money to the bottom line if they are also in the hospital and physician reimbursement business. If you can reduce your overall cost by treating people at home where it's less expensive more, in other words, pay more for in-home care, the studies show that that reduces a payer's overall costs. And this industry, both personal pay, private personal care, private duty pay, all the way through Medicare and Medicaid, have been trying to deliver that message to payers for years, and seemingly to no avail.
Well, I think the tide is shifting on that. I think, first of all, the government is recognizing that, and as the government and clinical teams and organizations understand the impact of social determinants of health, then people recognize the value of, when we're not just reacting to needs and we're actually trying to shift from reactive care to proactive and predictive health management, the best way to do that is understand what's going on in the home, in the setting, and consumer demand is just growing in that space. But I think we have to approach it the way Amazon would approach it, which is, as we think about providing care in the home, how do we automate what we can where possible? How do we move online what can be done online and manage it nationally, because we can manage it more cost effectively? And then how do we do it in a predictive and preventive way? One stat that I know from my days in telehealth that Cigna had is they did a stat comparing a set of their population that had telehealth visits versus a similar group, similar demographics that didn't have telehealth visits. And this is back when, similar to your point, the industry was worried, well, if we let people get these telehealth visits, they're going to do more visits and it's going to cost more. And what they actually saw over the course of 3 years was the people that were doing telehealth visits had 17% lower total medical cost than the population that didn't. And the reality was, it's because they were getting care that was timely and in the home versus going to an ER or an urgent care. And so as we think about the home, if you think about home-based primary care, think about that as virtual home-based primary care. Yes, you might see your doctor more often, but you can potentially then catch something and prevent something much more expensive. And or you can get therapy in the home that, if you get that therapy, that's going to reduce a lot of other costs or help you, maintain or lower weight. Because if you let that go, let that diabetes get out of control, it's going to cost more. So the data is absolutely showing that the more we care for the person as a whole, the more we can actually invest on the front end and prevent more cost on the back end for things that were preventable.
Well, that's encouraging. The more that message gets to the payers, the better for all of us.
And the payers are coin operated. So when the more you have data, the more you can go to, we know we're working with our clients to use their data as they go with payers and try and come up with new reimbursement models. And in the hospice space in particular, a number of our clients are trying to demonstrate the sooner they get involved in palliative care and the sooner they get involved in that journey, the lower the cost is for the payers than waiting till the last 2 weeks or 2 months of somebody's health journey.
I think somebody named Ben Franklin said something about that, about a penny saved years and years ago. So,
yes,
so
in healthcare, we often do trip over dollars to save pennies.
Okay, so with that as a framework, you have been at Complia Health for a year and a half, and you were brought in to effect change, to have a view of the future, to grow the company. Obviously, every CEO is tasked with growing the company. And so I'm anxious to hear your plans for how to do that. First of all, people, my longtime readers are familiar with the history, with the ContinuLink product coming out of Interim, and then the acquisition of Suncoast for hospice software, and then the alliance with Procura, and then Procura was acquired and left you with those two products. Is that where we're at now? ContinuLink and Suncoast as your primary platforms?
We've done a bit already in the past year and a half, which I'll get to, but yes, that is the history and the core of Complia Health. And I think one of the strengths of it is while we have two platforms today, one for home health and home care and one for hospice, both of these platforms and the core of the culture is technology that was built by agencies for agencies. And while there's a lot of areas for improvement, and we've done a lot of things to address those, at its core, the company is still very much about the care team and about the needs of the agencies. But go ahead, you were going to ask another question. Sorry.
Yeah. I want to know specifically how that looks. What are your plans for the ContinuLink product? What are your plans for the hospice, Suncoast? And there's something new that I saw at your booth at the NAC meeting. You call it Emma. So I want to give you a chance to tell us what that's all about as well.
Sure. So we're focused on a 3-phase strategy that at the highest level is phase 1, moving towards a single platform across all service lines. Phase 2 is about automating as much of the chronic condition management, consumer engagement, family engagement services. And phase 3 is about providing remote care team for things that can be done remotely. But a bit more detail behind that. Phase 1, and since I come in, one of the things that we really focused on was, and it was a conscious decision in terms of our top priorities, to say our number 1 priority is to have the best product in the industry. And again, that sounds simple, but so many people get caught up in so many other priorities, but it's just shifting the core belief to say, hey, we're going to win because we're going to have happier clients by having the best product in the industry. And so we've invested significant amount of money in the existing platforms to just say, what are the simple things we can do to automate as much of the routine? How do we remove double documenting things? How do we remove as many clicks as possible? And how do we improve the user experience? So we formed a product management group. We formed and brought in a new lead who, brought in a human-centered design expert. And is part of this focus on improving the existing solutions. Phase 1 really is about, we have stood up and we have now built a single platform that is a bridge to the future that essentially starts by liberating the data from our 2 systems as well as from other systems that our clients have, and make sure that data is interoperable. Because while we want to provide a single platform to everybody, we know people still have to interoperate with a lot of people. So ContinuLink and Suncoast will stay around for a few years, but slowly over time and transparently to the end users, we will be shifting the old platforms to this new platform and modernizing the experience while doing it. Emma, who is our electronic medical management assistant, is as part of phase one, but will apply to everything going forward, is your electronic medical management assistant. And so if you think about it back to trying to think more disruptively about healthcare, Emma in phase one is focused on back to automating the simple and routine just between the agency and the field. Perfect example, our head of product was out at one of our top clients and they had a canceled shift. And he observed, two hardworking, dedicated people making calls for 45 minutes between talking to the client, talking to caregivers, and everybody high-fived when they got that shift filled. It was so great. And of course, the first thing my head of product thought was, Uber, can't I be anywhere in the world, click on this app and get a car to where I need to go? One of Emma's first tasks is, how do we automate a shift blast? Something as simple as, hey, if there's a canceled shift, let me select the caregivers that are matches for that shift, send out a blast in a secure way, and then let the caregiver say yes, no, or I can do it, but at a different time, and automate that whole process. And so Emma's part of that strategy to automate the simple and routine. So phase one is moving towards that single platform with improving our analytics and machine learning and artificial intelligence to drive those analytics. Phase two, which we're really moving into this year, is where we're going to get more into the chronic condition management as our clients start to diversify service lines, and as they want to work closer with payments and take on more risk, we're trying to help them be in a position to do that. And Emma's a big part of that. It really starts with, hey, if every interaction in healthcare could start with Emma, and then she helps, she's the brains behind Complia Health, continuously monitoring all the data we're collecting across the system, and then intelligently routing to the right level of care member or care team member. Not only is it more efficient for the agencies because you keep people practicing at the top of their license, but also delivering care in the way the consumer and the family wants it. And then I think, towards the end of this year, next year is when we will start to do what I've done in the telehealth space, which is build that remote care team where we can provide services. Anything that can be done remote, we can do it under our client's brand so they can get more out of their existing staff. So think about it, even if it's only 10 or 20% of your visits, whether it's the skilled nursing or the therapy or even the personal care services, if it can be done remote and we can do it, you're freeing up staff to take on more visits. So you're growing without having to grow staff at the simplest level.
There are two ways to solve the staffing problem. One is to get more people. One is to need fewer people to accomplish the same care.
Right, exactly. And that's technology and automation is what drives the latter.
So it sounds like you have big plans for Complia Health. And if I understand correctly, you're moving toward a platform in the cloud that will incorporate everything that you're doing now with 3 different products, the Medicare and the Medicaid in-home care, plus the hospice in the home, will eventually be unified onto this new platform?
Yeah, by the end of this year, next month, we'll already have our early adopters where the data is already liberated across all service lines. So again, today we have ContinuLink that is dedicated to home health and home care, and Suncoast, which is dedicated to hospice. And the new platform, official name yet to be announced, is liberating that data so that you can actually understand those populations and drive, predict where needs are coming and drive those operational efficiencies and better outcomes with that single platform. I mean, it's our core belief that what happened in the hospital and healthcare setting, or the hospital and the doctor office setting, that as people grew, they wanted to move from specialized platforms to a single platform. We're predicting that as our clients continue to do M&A, their technology environments are becoming more complex. And so they're going to want to simplify for the benefit of not only cost synergies, but really it's much tougher to coordinate care across service lines if you have multiple platforms doing it. And as our clients are growing and diversifying, we want to give them a single platform for everything they need. And if they have a certain tool or software or something they want to do outside of our platform, we want to make sure we're as interoperable as possible, so that even if it's not on our platform, they at least can monitor all the data, all the information to make that shift from reactive care to proactive predictive health management.
So it will be a repository for data from in-house and from third-party products that a customer of yours might be using.
Correct. Absolutely. I think it's the only way we can help our clients succeed in the future. And I think it's the only way we can help them prepare to partner with, or for those that want to compete against, the MA plans or the MCOs, for those that want to take on risk on their own. But at a minimum, for those, we're going to help them better partner as the government and agencies are, forcing the move towards risk-based contracts.
Yes, clients of yours and everyone else's, all of the industry is looking for ways to increase their competitive advantage these days. And it's getting harder and harder, but it is still a primary goal.
Yeah, and my advice to everybody would be, if you start by thinking consumer first, automation and convenience first, that's what's going to be required as just a first step to compete in the future. It's happened in every other industry. And it's happened in urgent care. It's happened in primary care. There's no reason to think that it wouldn't happen in the setting that would benefit the most from it, which is in the home.
I can't think of a better way to wrap this up than with that piece of advice. And we're close to the kind of time limit that I've set for out of courtesy to viewers, so they don't have to spend the entire day. We could go on and on, but people like to get back to work after absorbing all of this wisdom from you and whatever I can offer as well. So
I'm happy to share. Go ahead.
Rich Berner, CEO of Complia Health. I will put contact information for your company at the immediate end of this video. And for those of you who are watching with us, I'll let you know, I'll put contact information for myself as well. If you don't happen to be a subscriber to Home Care Tech, the Rowan report, I'll put that information up there so that you can get in touch with Rich's company, Complia Health, or with me at the end of this as you wish. We're both wide open to hearing from you. Correct?
Yeah, absolutely, Tim. And I got to thank you personally as someone who's fairly new to the post-acute setting. While I am not new to healthcare, your report and the information you've been sharing has been valuable for me. So I'm happy to help out however I can with your readers, your audience. Because again, while we're all a little bit competitive, we're all in this to make healthcare better for our friends and family. And so the more we can all attack this mission together, I'm happy to help however we can. And I know the team at Complia Health is very excited to help everybody get there.
That's great to hear. That's why I've been doing it since 1999 as well. So,
all right. Well, you enjoy the holidays, Tim.
Thank you very much, Rich Berner, CEO of Complia Health. Thank all of you for joining us. This has been Meet the CEO. There will be more sessions like this with advertisers and sponsors of the Home Care Tech Rowan Report newsletter. So stay tuned. We'll be bringing you more of these as we go through the coming year. Thanks again. This is Tim Rowan. See you next time.